My name is Ruth Thompson and I'm the Macmillan Haematology Clinical Nurse Specialist in Belfast City Hospital. When I first started in this role, there were a lot of needs within the department. The consultants were spending more and more time with patients who had very complex needs, and so there were some patients who were seen very quickly. There was not a lot of time spent with these patients, and yet those patients had needs and concerns as well. And so we set up nurse-led clinics within the haematology unit. So every time they come up, they know they're going to have the same person to talk to. And being a Macmillan professional also helps me to identify other resources that are available to the patient so that they are getting all the care that they need.
My name's Charlie Brady. I've been diagnosed with aplastic anemic. It is a rare blood disease. When I was diagnosed, it has just taken over your life. But with Ruth, the way she's organised it, she seems to give us a lot of more time to ourselves and the family.
These patients are coming up for numerous clinic appointments. By seeing Ruth, she's completely focused on them, the time is theirs, and she's holistically assessing all their needs. As well as that nurse-led clinic, she's taken a lot of the pressure capacity problems off our consultants. She's set up a telephone review clinic. She's implemented a blood home transfusion service, which has prevented a lot of patients who are frail or elderly or at the term sort of end of life care having to come up to the unit.
I need blood at least once a week and platelets once a week. And Ruth has organised us to come out to my home. She has made a big difference in my life.
I attended the Macmillan Professionals event 2 years ago, and I remember at that time coming away and I was just so enthusiastic, really well motivated. I was going to come back and I was going to change services within haematology in the City Hospital. Sometimes I really felt like a pest when I was going to people numerous times about the same problems, but I think you need that determination in order for any of these projects to succeed.
Ruth has worked incredibly hard over the last few years to not only improve the service that we offer to our patients, but also she acts as an educational resource here for a lot of the staff, very much a role model. She strives to continue to develop the knowledge base that she has, as well as develop the service, and that will continue for as long as Ruth is with us.
From the first day I met Ruth, she was something special about her. I would say she's just a born organiser, and it's all in favour of the patient. This is a great hospital, and she's one of the angels of it.